Well, I finished IV chemotherapy I'm kind of losing track, which is a good and a bad thing at the same time. I suppose if I whip the calendar out, I could be exact, either 8 or 9 weeks ago. And I've been here before, and it's not fun or an easy place for me. So, if you've been listening to me throughout, I don't know, the origin of the Precarious Podcast, you've kind of watched me, so to speak, process in front of you, what it's been like for me. And I'm in this place of no longer being in, what's considered intense treatment. And it's a whole different chapter. I thought it might be interesting to let you in to how I get through this, when I reach out to my person, my counselor, my support. And I'm going to do that. So it's a whole new level of letting you in. This particular episode is the recording of a session that I had with Dr. B.J. Miller, who is my palliative care physician. I actually interviewed BJ as one of my very first guests on the Precarious Podcast. This session that I'm sharing with you is unedited, so you get to experience the whole thing from beginning to end. It's me, him, our conversation about struggles, at this moment, at this point in my experience of living with advanced cancer with a terminal prognosis. And just a little background about B.J. Miller, if you're unfamiliar with him and his work. He himself is a triple amputee, and so he draws from his experiences with disability. He has been featured in a number of publications, been interviewed by a number of people, New York Times, Oprah Winfrey, Krista Tippett, co-written a book. So he has become fairly well known in the field of palliative care and hospice. So here is my session with Dr. B.J. Miller. Well, the last couple of times that we've met, we've touched on meaninglessness. It's a mouthful, but and haven't really gone into it. Mm-hmm. And I've decided, what is that resistance to me? But I wouldn't mind spending some time talking about that, all this making meaning around life's hard stuff, especially facing the end. I'm not going to lie, I have found comfort in making meaning. Again, things don't happen for a reason. Life's, hard and shitty and random things happen. Mm-hmm. And I have found some comfort in looking at all that stuff and just trying to make meaning or make sense of it. And I think because coming through this last recurrence in the treatment and now being in this, I don't even know what to call it, bit of a respite. Mm-hmm. I'm too tired to make meaning, I guess. I have to really be honest. Uh-huh. Or resistant to it, or I kind of feel lost and there's no meaning. So that's why I kind of want to explore this kind of notion of meaninglessness.
Mm-hmm. Wow, good. I'm glad to hear you say that, because it's where my mind's been lately too. And in to my thinking, it's sort of like, this is advanced work in a way, to my way of thinking. Not to put any of this in a hierarchy, but it's hard to get to meaninglessness until you've kind of gone through the meaning making stuff. At least from where I sit.
Mm-hmm.
So this is a far side of many hills. So I mean, let's maybe start with, let's find our way into it. Like, how in this last couple of weeks, and since we last spoke,
Mm-hmm.
for starters, has there been how have you been spending your time? Are you finding your moods? Yeah, how have you been feeling?
Yeah. Let me start with how I've been spending my time, because that is probably just easier to go at first and then try to identify moods. I have been a little frenetic. Like there is this pent up, I don't even want to say energy, because I'm actually physically exhausted, but this pent up demand for experiencing my world around me, since I'm not getting IV chemo once a week and then shots twice a week and then maybe a blood transfusion thrown in there and then really sick. And so I've been working more. I've been getting out more. I've been trying to engage with people more. I've been, and this is what I worried about, because I think you and I've talked about this through treatment. Like I was worried I'd do this. I would do this busyness thing. I do have some downtimes because I'm purposely and with intention slowing down. But so I'm busier. In my moods, I guess I'm super curious about my moods, because I thought that maybe there would be this happiness or this gratitude or this relief that would result from finishing this bout of treatment and re-engaging in my life, and those moods have not appeared, those mood states. Instead, there has been not apathy is probably too strong of a word, but like an emptiness, basically. That's it, an emptiness. Like I'm trying to fill up my heart and soul with the things that used to fill me up. And they do. I don't want to, because if anyone's listening, I'm working more and I love my job and I love sitting with people and I love that kind of work. It's like there's this undercurrent though of empty, and maybe even some sadness, and what's it all worth anyway? What's it all for anyway? And yeah, that kind of stuff.
And then right on, okay, I'm with you. And are you having responses to your responses? Are you getting down on yourself for not feeling full of pep and gratitude and blah, blah, blah?
Yeah, I think not. Here's the relief. Normally that answer would be yes, but I'm not having that secondary reaction. The secondary reaction I'm having is sadness. Like, oh, you're feeling empty. Oh, that's sad. Like, I wonder why you're not able to kind of engage in that joy that you used to feel around these things. I mean, I have that commentary going on. So hallelujah, at least I'm not judging myself in that negative way. It's more like, oh, that's sad. that kind of noticing.
Is the feeling sad, or you're saying it's sad to not feel great?
That's it. Yeah. It's sad to not feel great. Yeah. And I don't know if it's like trying to chase after, this is going to sound like an extreme metaphor, but like to chase after a high. It's not quite like that, but I feel like I'm running after this feeling that I can't quite get. And it just, a lot of these big existential questions, like, well, which is why I'm talking about meaninglessness with you. Like, what's this all for anyway, kind of thing.
Mm-hmm.
Yeah, if I listen to myself as a therapist, I sound depressed, honestly. But because of what I'm going through, I know it's not like actual depression. I think it's kind of normal, I think.
Well, let's just next make sure. I mean, are you eating well? Are you sleeping well? Are you having intrusive thoughts?
That's a great question. I forgot I was gonna, interesting yeah, okay. Ding, 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 ding. I'm eating while I'm sleeping well. However, I am having intrusive thoughts, and that is, and that just happened in the past 3 or 4 days. And they're like post-traumatic stress, invasive, awful. Like, this is even hard for me to talk about because I'm so upset that this is intruding into my head and my experience. And like, I'm in the shower and all of a sudden I have a memory of being in the shower in the hospital.
Mm-hmm.
And how hard that was to even stand up, and I was in so much pain. And or I'm getting ready to go to bed and I actually, lie down, and instead of realizing I'm in my bed, I have a flashback about being in a hospital bed. So yes, wow, I totally forgot I was going to bring that up with you. That's how much I want to suppress that. That just started happening about 3 or 4 days ago. These really kind of the highlight reel of my most painful experiences going through treatment.
And they're specific to treatment, and they're
Mhm.
specific to the hospital, or at least the medical world.
Yeah, those are the ones that pop up the most. I have some images that intrude of being at home sick, but most of them are the most, being hospitalized and how sick I was through those things. So whether it's the NG tube memory, or I've got tubes hanging out of me and I'm trying to take a shower, or those kinds of just, I even had an awful dream last night about waking up in my own blood, like I was leaking blood. Yeah, I know this sounds like, how could you forget to tell me this, Leah? But
No, you're giving me the reason why you would want to. I mean, yeah, I get that. Well, so speaking of meaning making, is there a translation that goes with these images or these intrusions?
No, gratefully, I am grateful for that. I think maybe my experience of being in mental health and having gone through this so much, I think I'm just giving myself a lot of space for these kind of intrusive thoughts. It's I was so focused on getting through this IV treatment, chemotherapy, for the past 6 months that I didn't really have space, a whole lot of space anyway. And so now that there's some breathing room, it makes sense that this stuff that's deeply embedded in my brain and my body is going to just decide it's going to knock on the door and not ask for permission to come in. It's just going to start happening.
Yeah. Maybe because this emptiness you're describing, because there's space.
Yeah, exactly.
So do you see how, or does it register that that's actually, does it feel like, even if these thoughts and images are out of your control per se on some level, does it feel like constructive? Do you think that this is your body and your mind processing something? Does this feel maybe painful and annoying or intrusive, but does it feel constructive? Does it feel like your mind's up to something useful?
Yeah, I always wonder about that. My default answer is to give it the benefit of the doubt. Like, yeah, I guess this is stuff in there that is working its way through. And yeah, I think that's what I answer to that. Yeah, I think I'll stop there, not overanalyze it. I think so.
Okay. Yeah. So in other words, this may not be a process that you really want to, maybe we can refine it or tweak it or shepherd it a little bit, but maybe it's not something you want to a spigot you want to turn off. Or what do you think about that statement?
Yeah. Well, my first response is, God, I would if I could. I feel like I can't. Like, even though I believe it's a healthy reaction and it's a part of healing, it is so scary and painful when those intrusive thoughts just come in. If I could turn the spigot off, I probably would. And maybe I'm grateful that I can't, because I do think it's probably a natural thing. Yeah.
Yeah, it does. I mean, it does feel certainly natural. And I hear you that you'd want to, if you could, you'd turn it off. And, you and I have tripped on all sorts of things that the power in them, it has something to do with the inability to control them. That's part of their power.
Yeah.
So maybe these are some things we'll watch together a little bit and see how it evolves. And if we're really feeling stuck, or this starts feeling like a chemical depression, we should, address it accordingly. But let's circle back before we abandon that notion. Like, do you feel, Leah, that have you answered your own question about whether you're depressed?
Yeah, I agree with you to watch it. I think the jury's out, and that I could see myself, like, that wouldn't be surprising if a few weeks from now, if this doesn't shift or grows more entrenched. Yeah, that would make sense, and understandably so. And I want to leave the possibility open that it's a natural aftermath process thing going on.
Yeah.
I remember each and every time I've come out of treatment, I've had these experiences, like it's this just post-treatment, I don't know, like phenomena or something, I don't know what to call it, that, you think you'd be running across the finish line, arms up in the air, fist pumping, yay, oh my God, I made it, I'm not dead. And like, I'm not doing that, I mean, like, I'm just like, everyone seems really happy around me. And I'm like, oh, okay, yay, I think,
Oh, I know this zone you're talking about. And does it, I mean, with clients, have you bumped into people who are in this zone? Because I do a lot. It's not an abnormal place you're describing. Are you surprised by it though? I mean,
yeah, I think I would be surprised by it if I hadn't done it like 4 times. The first time around, I was really surprised by it. And I also remember feeling really misunderstood and hurt and resentful when the people around me were a little pissed, kind of weirdly pissed at me that I wasn't on cloud 9, because they were.
right.
Like, and I couldn't describe why I wasn't. And now I'm like, oh yeah, this is familiar. It's familiar, though I forget each time, and then I feel it again. I'm like, oh yeah, that's right. Yeah, but I could also see, this is why depression's an interesting kind of diagnostic wonderment, is that I think it would be really understandable, normal to fall into a depression. Like, this isn't a phase, and then it becomes something different.
Yeah. Right on. Well, let's at least, I'm going to keep talking, obviously, and let's keep an eye on these things. All of the above. But, does the word trauma light up for you here? Do these feel like these are trauma pathways sort of playing out?
Yeah, I think so. I think so, just because the feeling hijacked by the intrusive thoughts and the intensity of the imagery, and then the emotional reaction I have, and it feels and tastes and smells like trauma to me. So yeah.
So with that overlay, does that make you want to handle these any differently or do any different? If all these like depression begs for a slightly different, trauma, et cetera, blah, blah. So with that word in the mix now, does that tell us, like, and or if this is the 4th time you've had this reminder of this sort of this coming down, do you remember how you handled it in the past? And are there any cues from your past to help us now?
It's a great question. I actually think the first 3 times I buckled my seatbelt and just tried to ride it out, hoping I would, eventually land somewhere, although could it be a bumpy landing? And this time, I think there's part of that with with trauma, but this time I noticed, even though this is very recent, like the past 3 days of these experiences, I'm feeling like I want to be more proactive around it, and like practice my own medicine. I mean, all these conversations I have with the people that hire me to help them. So, for example, when one of the images appeared when I was in the shower, because it reminded me of being in the shower in the hospital numerous times, and with, anyway, I don't need to replay that. I practiced grounding, meaning I was in my shower at home. I looked at my belly. There were no tubes hanging out. I touched my scar. I felt the water on my skin. I accessed those types of grounding tools to get me out of the panic, freak out, trauma thing. And it worked, basically. So that was intentional. I mean, I might have been doing some of those things in those earlier experiences, but I don't remember being intentional. I think I remember just somehow like wishing it away, and eventually it dissipated, and I kind of took a big sigh when, thank God, that went away. So this time I want to feel like I have more agency.
Right on.
Yeah.
And sounds like you do.
Yeah.
You're able to talk yourself down, if that's the right language. So with that, so do you have, on that note, in terms of like if and when these thoughts come back, do you know how you want to handle it now? I mean, is it so this aesthetic, this bodily grounding seems really, really key. Trusting your senses to tell you that you're actually not in the hospital right now, et cetera. Just like you're describing. That seems huge.
Yeah.
Can you snap? Do you think you'll remember to go there?
I think so, because it was such an effective like intervention that I think my brain and body remembers that worked so well. I think that's going to help me do that again. And I've just, historically, I've had experiences that using the senses can absolutely bring us back to the now really effectively.
Righto.
Yeah.
Righto. Well, let's remember that too. We'll bridge back to the importance of that statement vis-a-vis emptiness and meaninglessness too. That's not, we'll circle around, but is there, in thinking through sort of the trauma lens too, like we've talked, that there was so much about the medicalized, the hospitalized, the pain that signifies and presents. And remember last time when you were moving through treatment and you landed and the thing you were fearing most, bowel obstruction, happened, and you dealt with it and you moved through it, and remember all those experiences.
Yeah.
Is there something along those lines here too, Leah, where like, what do we think those thoughts are symbolizing or pointing to? Is it the fear of death? Is it the fear of pain? Is it something else? What's your translation?
Yeah. I think it is the fear of the suffering part and the pain part, not so much the death part, which I'm relieved to hear myself say.
Yeah. That's a big,
it's so interesting, BJ, because every time I get in touch with the fear of suffering and pain, like at this very raw, like, I can't do it. I can't tolerate it. I'm somehow gonna, I don't know what, I can't even finish that thought, to be honest with you. It's that visceral. But then you remind me, and then I remind me that I've been through so many of these things. These things that I think I can't get through.
Exactly.
That I don't know why it's like my brain does this hiccup. It's like it either erases or discounts or says that doesn't matter. I don't know what is going on that I can't seem to like lean into my wisdom and history and credibility of getting through the things I'm most afraid of. It's an interesting, I don't know if it's just this sort of lizard brain reaction. Like all the frontal lobes are trying to like talk me down. And the fight or flight response is, we can't hear you. You know, it's just, I don't know what the disconnect is.
Well, let's say it is exactly that. Lizard brain is old brain, deep brain. Practically impossible to circumvent it. You can respond to it. And I think in time you can turn these reflexive fight or flight moments into something more of like a suggestion than a demand of your body.
That's awesome. Yeah.
And I'll remind you, you already do that. So maybe it's just remembering, giving it a little time. I mean, there's no mystery in why you might fear suffering. I mean, geez Louise.
Yeah.
So maybe there's a little 1-2, like a 2-step here. One is get your bearings, go to the aesthetic, okay, right? Use your eyes, use your senses to locate yourself, and then pretty quickly, maybe once, if that settled you a little bit and allowed for other thoughts to come in, maybe the next step right on its heels is to say, hey girl, remember when you were in the hospital, or however you want to say it, in the hospital, remember that bout? Remember, just gently, submit your credentials to yourself. I love that word, your credibility. That's so good. Right. You do, these are not theoretical moments for you. These are not ideas.
Yeah.
So maybe, what do you think of that? Is this about this sort of 2-step, like honoring the impulse, the lizard impulse? Jesus Christ, of course it's terrifying. And that's the impulse. And then you get your response, go to the senses, orient, and then submit your past.
Yeah. I like that, because I think you've got to ground first to be open to your frontal lobes to having a conversation with you. And yeah, that's great. I think I was doing part 1, which is awesome. It got me off the cliff. But the disconnect of, what do I do next time that fear hijacks me and I feel like I can't get through something? I was not accessing my resume. All the shit I've been through, like some really hard stuff that I'm still afraid of. Like, but you did that.
Well, maybe you're just humble. Maybe you're not throwing your CV around too loosely.
I don't want to brag.
Yeah, exactly.
But I'm doing myself a kind of a disservice. No, that's great. I think maybe part of the disconnect, as I'm realizing this, is that reflecting on how I got through that really hard stuff is still remembering the really hard stuff. So I just have to remind myself that, but you do it really differently. Like, you're presenting it through the lens of, you got to the other side, and these are the things you did to get to the other side, versus just remembering the thing.
Right. You're not just reliving the trauma, you're reliving, if that's the right word, how you got through that trauma. So don't cut the sentence short.
Right, exactly. That's what I was doing. I didn't finish the story.
Right.
That helps.
Okay, girl. Well, let's see. Let's see how that goes. And that sounds good to me. One other question on that, though, especially vis-a-vis these dreams. Is there any? Let's just check real quick. Is there any new information that's trying to come through? Any new fear or concern or worry before we kind of conclude that these are familiar old tapes? Is there any sense that there's something new in here to pay attention to, or that your mind might be wanting you to look at?
Yeah, that I think I can identify. At least I attached meaning to that. I think it was last night or this morning even. I think what's going on is, well, I'm going to say this with certainty, even though I don't exactly know how I'm going to die. These diseases, maybe both breast, ovarian, something, or maybe a third one, because now I'm on a drug that may actually increase my risk for leukemia. Yay! point being, I think I'm bracing for like a symptom to come up. I think part of what these images and these dreams around, illness and something going sideways physically is like, that's going to happen again. Not to be morose or a pessimist, I'm being a realist. I mean, it's part of facing my mortality and living with these diseases. Is this will come back. And so I think part of what's going on, besides processing the trauma, is this vigilance around, what was that ache? What was that pain? What was that, the dream is reminding me about symptoms I used to have. And so I think that's going on too.
Righto. Righto. Well, that seems vital too. That seems important, because it is, you're right. It's not if, it's when. We know this.
Yeah.
So details, of course, to be determined, but I wonder if so in that, with that lens, and before I say anything, first, I just want to, I'm so sorry, sweetheart, I forgot to look up your meds.
Oh, that's okay.
Totally. I'll circle back to that.
I can tell you.
Okay.
Yeah. That's why I was joking about the leukemia. I probably should make light of that. But the PARB inhibitor I'm on, which is a fairly new class of drugs, and a really exciting development for ovarian, breast, and prostate cancer, I think. More and more data is coming out the longer it's been used clinically, and the fact that I've been pre-treated so heavily with traditional chemotherapy drugs. There is a small percentage of people who've been heavily pre-treated when they're on these PARB inhibitors who then develop myelodysplastic syndrome or a leukemia or something like that. And because I've had so many transfusions and my bone marrow already looks pretty tired, I think, I'm not overly worried about that, but I don't think it's out of the range of possibility.
Yeah.
That I think that was my bleeding dream. That, my platelets stopped, I didn't have any platelets or something like that. So yeah. So that is, and there are other just sort of daily quality of life side effects, like low energy and poor appetite and GI distress and things like that. But I think the kind of scary one is the kind of leukemia process, affect your bone marrow one. Yeah.
Right. Well, while we know something's coming, we don't necessarily know that that's coming, but I hear, but I hear you that's something their mind is taking seriously. Real quick though, we just, not to glance too easily past, fatigue, disruption in your appetite and all that those can be real daily drains. How are you doing on those simpler fronts in a way?
Yeah. It's I feel like, because it's all relative, and I came off of IV chemo that very much on the scale of 1 to 10 being heavily affected, symptomatic.
Yeah.
This is, if that were a 10 at times, this is like a 4. And instead of being pissed off that I'm even experiencing a 4 out of 10, I'm like, oh, it's a 4 out of 10. I mean, ask me next week and I might be sick and tired of it. And I just, I've only been on these drugs 2 weeks. And so maybe they accumulate. And again, I need to figure that out. But so far, I have moments of feeling pretty bummed that I don't feel well at times. But then I also have moments of feeling, relatively speaking, I'm okay. Yeah.
And just real quick, we haven't talked about it in a while, do you still have access if it comes to treating side effects or anything? Do you still have good contact with the palliative care team at the cancer?
Yeah, exactly. And so I'm still plugged into the team, and we took a bit of a break from how often we were meeting. Actually, as a matter of fact, we said, once I start these drugs, which I just started 2 weeks ago, that please reach out to them if I develop symptoms that are really affecting my quality of life.
Okay.
Yeah.
And of course, we can talk about that stuff too, but that's good. I mean, I'm glad you have that access. Whether you need it or not, we'll see.
Mhm.
Okay. Well, so back to this idea of, whether your mind's pointing you to some new, not just old tape coming up, old fears coming up, but maybe there's some new concerns, new preparation work going on here in your mind. Like with that dream of blood.
Mhm.
Do you remember? Do you remember? Did any feelings go with it? Do you remember what your emotions were in the dream?
Yeah, I was terrified. I
Mm.
think, and I remember actually when I first started working with you and I hadn't started treatment yet again. And I remember, this is interesting. These are very much connected. I remember trying to anticipate, so interesting. I'm such a control freak. I'm not sick yet and I haven't started treatment yet. And the disease isn't really causing symptoms yet, but I'm going to imagine, I'm going to try to imagine all these scenarios so I can be prepared, which is why we had those long conversations about bowel obstructions. Remember that?
Yep.
So I feel like probably what the dream is doing is like, here's a test scenario, Leah,
Mhm.
of something that could go wrong. And how are you going to handle that?
Mhm.
So waking up in the dream, because I was dreaming and then I woke up and then I saw this blood. I was helpless. I didn't know what to do. I couldn't get to the phone. I mean, classic nightmare stuff, right?
Mhm.
No one was around. And so I think it's the fear that I'm not going to be okay, which is the mantra that I came up with you, that I'm going to, no matter what, I'm going to be okay. But so I've got these dreams or these invasive, intrusive thoughts that test my certainty of that. And just, yeah, like worst fears
Mhm.
is that maybe it's not the blood that's my worst fear, but it's I don't know, like being alone, or I can't get the help, or I don't know, like I can't quite finish that thought. But those, because it's more feeling,
Mhm.
I think it's something like that.
Mhm. Well, maybe, I think you and I assume we know what we mean with that "I'm gonna be okay" line, but let's
Mhm.
double check. What do you mean by that?
Yeah. Well, like it's a broad sweeping statement, so it can apply to every situation. But in this case, and maybe I should make it more broad, I think what I'm trying to say is that it doesn't guarantee that I'm not going to suffer. That's not what I'm going to be okay means at all. It doesn't mean you're not going to suffer. It means actually that you will suffer
Mhm.
and you are going to get through it. And I'm being
Mhm.
vague there too, because I don't exactly know how that's going to look. Like, I don't want to say, and people will show up for you. I mean, maybe not, I don't know, but it's, 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 you will get through it,
Mhm.
basically. I think my worst fear is, and so if you were to ask me, well, what does not getting through it look like? I, I don't know if I want to like say this out loud because it's pretty gruesome. It's like these awful nightmarish images of, I don't know,
Mhm.
bleeding out by myself. I mean, that sounds so graphic to give you that, but it's like dying alone and a God. And I know I can't necessarily stop the suffering from happening, but I would like to believe through working with you and being proactive with palliative care teams and being a patient advocate of my own self and cultivating relationships, that I'm setting myself up to be okay. That's
Mhm.
that's what being okay means.
Mhm. I'm with you. And for the record, being okay, you can be dying and be okay, right? It's not
Mhm.
getting through this doesn't mean living forever.
Oh no, exactly. As a matter of fact, I think what I'm really talking about is, yeah, the dying, yeah.
Mhm.
hmm
Yep.
No. Mhm.
Right. Just while we're being explicit. So, you know, and so far, I mean, it's very hard to say with great certainty how we'll feel when we're in a situation that we haven't been in before.
Yeah. Mm-hmm.
So I want to be careful how we choose our words, but it's interesting to note how, like, I get to sit here and someone who knows you, I'm as sure as I can be about just about anything that you will be okay. I can keep saying that to you whenever you need to hear it. And I really believe that. I actually really, really believe that. So, but I also want to be, and let's also be, we're talking about going through things that neither of us has really gone through on some level, right? So how do we know? I don't know. I don't know.
Exactly.
But I don't know. We kind of know.
Yeah.
So, first of all, I do think, do you have, I mean, does this, like when I say that I know you're going to be okay, you are going to be okay, Leo. That's coming from my gut. That's coming from my viscera, that's coming from my belly. I believe that in my fiber because my brain can't prove it.
Yeah.
Do you mean that too? Does that place, like, is that your guts? Is that the sense you want to be talking to and in touch with? Is that gut sense?
Yes. Yeah. Because I'm really good at outthinking myself. So just getting it right in my head isn't, I mean, it's something, it counts for something, but it's more of a knowing. It's more of a knowing. Yeah.
Right on. Well, let's be sure to not accidentally project what okay looks like and then set yourself up for some sort of failure. Because what if no one's around? What if it's middle night? What if you're by yourself? What if there's blood?
Yeah, exactly.
First of all, let's just check in. Like, as we're talking about this, how's your nervous system doing?
Oh, it just totally spiked right there. That was, thank you. I'm like, what's he about to say now?
Well, let's pause, girl. So can you check yourself, check your body, remind yourself that you're not in that situation right now?
Yeah, no, I'm staring at you through a screen. I'm in my office. Yeah, I'm looking down at my belly. There's no blood. I'm good.
You feel the floor.
There's the floor.
Feel your body. Your eyes. You believe your eyes. Okay.
Yes.
All right. And then I wonder, is there a room for that earlier two-step here? Like, we may not know exactly the details of the future, but the past, if all these moments are variations on themes, is there a moment here of reassurance of how you've dealt with unknowns and unknowables before?
Yeah. And then usually it's, no matter how awful and hard I'm afraid it's going to be, and at times it has been, I have gotten through it. And that matters. I mean, that's coming full circle to the beginning of our conversation today. It's like, I get to claim that. And again, I don't want to say that my worst case scenario never turned out to be true. It actually has turned out to be true. And that's even hard for me to say because that's a scary thing. And I got through it.
And you're exactly right. The finishing that sentence. Yes.
Yeah.
Right.
Yeah. Which is, again, through it doesn't mean I'm going to be better and cured. It means that hard moment at that time.
Yeah.
Yeah.
Maybe you will stay intact. You will stay you will be whole. Something in that zone. Is that right?
Yep.
Yeah.
Yeah.
So right on. And so we do know, and you're not alone on this, like our imaginations tend to project things worse than they actually feel like to be in.
Yeah.
Or at least an incomplete picture. Whenever you're actually in that thing that you had feared getting to, you have every time found your way to being okay, whether that's because new information came online or your body surprised yourself or whatever it is.
Right.
So maybe there's some back to, some trust, some faith.
Yeah.
Feel within reach.
It does, because of the credibility. I also and this is hard for me to really relax into, but each time I have an experience and this shows up for me, I can believe it a little more. And that is, other people help. I mean, I think part of my fear stuff is somehow I think I'm supposed to do this by myself. I know that sounds really irrational. I don't believe that to be true, but when I get in touch with the fear part, like the imagery is I'm alone. And I may have been alone for parts of these things that happen, but not for very long. And others show up and help. And whether that's a medical team or, I mean, there's that part that I want to remember.
Right. You get to trust that too.
Yeah.
You have, and that was when you were a moment ago, when you're talking about how you've been preparing yourself, with talking to me, palliative care, your relationships, your work, that's also on your list of things to trust. You have constructed a world around you that can hold you and has proven to hold you.
Yeah. So, it's pretty beautiful, actually.
It is.
Because that's my old stuff that I could be in therapy forever around, is not believing that people are going to show up and have, this somehow story that I'll be let down. And so this has been pretty kind of amazing to have lots of corrective experiences through this really shitty thing that's been going on.
Yeah. I know. Well, that's on your list of things you get to trust. You made it. You've made these things. You've created these things. They're real. So, okay. Well, maybe we're finding some way. So to at least address or respond in terms of next moments, other dreams coming along. I wonder, did you wake up right after the bloody stuff, or was there more dream?
No, it just woke up with it. It was like one of those early morning dreams. And so I just woke up and actually kind of ran into the bathroom just to need to look in the mirror to make sure my eyeballs were seeing this, trying to trust what was going on. Yeah. Looked at the sheets, is there blood? Yeah. So,
yeah. Well, I hear you checking, you're trying to approximate your imagination and your reality. That's an important deal. So, on that note, I wonder, and I know I'm no pro at Dreamwork. I'm just talking in generalities here, but I wonder let me ask you, do you find your dreams a useful kind of therapeutic zone to help you either gain insight into your inner world or to affect your life on some level, to work?
Yeah, I do. I really, I'm one of those people that remembers my dreams very often, frequently. And I appreciate all of what my dreams do. They're humorous, they're fantasy-like, they interweave, tidbits of the day into nonsensical, storylines. Like last night I had one about, the content doesn't really matter, though I think it's funny. I know what the feeling was about. That's why I can get to the dream work really easily. And I'm no expert either at all. I'm the expert in my dreams. I found myself riding in a driverless car, and I was in the back seat and on this crazy highway, and the car was out of control. And somehow, though, I was in the back seat with huge smile on my face. Somehow the feeling was peaceful, but my head was you should not be peaceful right now. If you actually look around you, you're careening down this interstate downhill on some sort of gradient that it's impossible to actually exist in real life. And it's like a video game because you're about to hit this pedestrian coming across the highway. It was I'm laughing now because, again, the content doesn't matter. The feeling was chaos, and I'm okay. Right? I'm my mind made this chaotic experience of, you're not driving the car, you're in the back seat, it's out of control, you're about to hit a pedestrian, maybe even a dog, which would be worse for you in your dream, and somehow you're peaceful. So wow, I like that dream content, not so much, but I like the fact that in the midst of chaos I was okay.
Right.
That was my takeaway from that dream.
Right on.
Last night's dream. Yeah.
Well, beautiful.
Yeah.
I mean, on some level, the content doesn't matter, where it's bleeding out or careening down a road. I mean,
Right.
insert chaotic, out of control experience of any kind.
Right. Right.
Well, so I wonder if there's a cue here for you too, and this may feel whether if you want to explore these moments, because we could think that, like, we're trying to bring your imagination and reality into line here on some level, so your mind doesn't get too far out ahead of you or behind you or whatever. Like, if there's perhaps your mind is offering you these snippets, these images, these scenarios as a kind of practice to help you develop your tolerance for the chaos, your ability to maneuver within it. Because, like you were saying earlier, if you're just so hijacked, there's no maneuvering, there's no agency at all.
Right.
So anyway, thinking of these as practice moments versus these intrusive, horror shows.
Yeah.
I mean, obviously you need to be honest with yourself, but I wonder if there's an honest reframe for you in there. And maybe before you go to bed, you prime yourself to say, okay, dreams, let's see where you want to go now, and see if you can coach yourself into the dream a little bit. So next time, maybe if blood or anything needs to come up, let's see if I can stay in the dream a little bit longer and deal with it or something.
Yeah. Yeah. That's a great reframe and interpretation that, I've often said, going through these really hard treatments, whether it's getting through a surgery or radiation or chemo, I think of those things as practice runs for, I don't know, I even call it death, because oftentimes I've felt so sick and poisoned by those things that, and I know that there is going to be some suffering and dying. I hope I didn't somehow poke a hole in anyone else's fantasy about their death, but I trust I'm going to suffer a bit. And the whole point is to mitigate that. So all the treatment I've been through, they try to mitigate the suffering, but there is suffering. So my reframe there has been, that's like practice. I'm practicing. So that's how I'm hearing you say, like with my dreams, like more of this kind of, it's just another pathway to get in touch with that emotional piece of fear of suffering or out of control or whatever my dream does. Yeah.
Right on.
Yeah.
Well, see if this, ponder like our conversation today. I mean, you don't need to ram yourself into these dreams if it's not, into working with this imagery if it doesn't serve you. But, let's see. I do like this idea of, I mean, you like to prepare, and this could be a way of preparing at a wholly next level. Like so many things we talked about over the course of your arc, you're going to next level, extra next level. You're going to deep places that are hard to get to. You can't just go right to these places. So, anyway, there's that challenge there if you want it. And also, by the way, I think you're wise to assume some suffering at the end of life. I think that's probably, most of us, that's probably true, but I don't know that that's an absolute law. So as you treat the unknowable, you can still make space for all sorts of things to surprise you, including euphoria or peace, some absolute absence of suffering.
Oh, I hope so.
I don't think that's crazy talk at all, by the way.
Okay. I would like that. I would like that. I would like to think that might be true.
Yes. Well, here's a really important refinement for us too here, like how to hold that hope or whatever the right word for that is, or that possibility, without expecting it or demanding it or needing it. So I wouldn't talk you out of the preparation work you're doing at all. But part of that preparation work should be in terms of holding space for things you don't yet know or haven't yet seen.
Yeah.
Include on that list all sorts of lovely things too, because that's just as likely.
Oh, that's a great, thank you for that reminder. Yeah. I wasn't creating space for that potential. And I hear you. It's not like it's a false hope. It's just out of all if I'm thinking about preparing myself, I really have to include all possibilities.
Yes.
And one of them is maybe it won't be that painful.
Maybe it won't.
Mhm.
No, and some of the times the folks I've been around have sensed that there is actually the suffering all was getting to that point.
Mm.
So much of the suffering was getting to that point. And at that point, though, a lot of that work's been done. And
Yeah.
it's a whole other thing that can happen in there too. I can't prove it. I can't preordain it, just observe from when being around that planet.
Yeah. Yeah.
So, okay. But I think this is also part of your advanced work. Like, I think earlier on, it's actually wise to presume some of these worst case scenarios so you don't like wiggle out of them, But you've done all that. So I think you can add to this list other things too. Anyway. Okay. Well, we've talked, it's interesting. We didn't really totally wholly get to meaninglessness today in a lot of ways. But this is a lot of groundwork for it, actually. It's related. And maybe until next time, Leah, maybe one of the things to do is, like you were saying, meaning. I'm all for it. Meaning is awesome. It is a very useful thing. And so I wouldn't want to talk you out of meaning where it exists and where you can find it. It's more like what to do in those moments where it's inaccessible.
Yeah.
And so maybe a place to start to explore this is something you've natively already been doing, which is maybe we can reframe that emptiness you've been feeling. If I think from my experience, I think a lot of us, the meaning impulse comes from a void. There's a space, there's a void, and it's hard to know what to put in that void, and voids can be scary and blah, blah, blah. So we supply meaning to fill these spaces. And I don't want to talk out about impulse, but maybe there's a refined thing to pry open, like a pre-meaning phase, like a pre-narrative, pre-meaning, that you can hold that space of, because that emptiness, its flip side cousin is infinite potential.
Yeah.
So before you ordain some meaning, see if you can hold the space, hold the void a little bit. And let's obviously talk more about this, but that may be a nice, good next step. Just protect it. And then also the other thing to protect that space before not rushing to give it meaning. Okay. And then related, it's sort of interesting questions like, what the hell does what's the meaning of meaning?
Right.
I think it probably means a few different things. I mean, one is, it's important, it's significant, it just means something, I think the way a lot of people then, that's one thing, but then it slips into, for other folks, more towards a purpose, more towards a narrative, more towards a story, cause and effect. This happened and then that happened and I took it and I created something from it. And that's all beautiful, but that's a lot of work and takes time and takes intellect.
Yeah.
And as you and I both know so well, those stories, while maybe meaningful at one point, then we can get stuck in them, and then we're we're hamstrung by those very same stories.
Right.
So maybe also in our marinade together, let's kind of ponder those two different kind of like, am I making sense?
Oh, totally. And I know we have to wrap up, but I'm right with you, because probably as my work as a therapist, I work a lot with people as I watch them want to make meaning. And again, I think it's beautiful, but when it gets to be this really prescribed story that works maybe for a while, until it doesn't anymore. And then they feel like they're a character in the story and they can't get out.
Yeah.
Yeah,
yes.
Exactly.
And then any story, God bless them, but they're always going to be incomplete. They're always, they're inherently reductive. Anytime we pick a word, we're ignoring a zillion other things, right?
Yeah.
So, right. So seeing it as a useful tool, but not confusing it with the reality it's helping us to navigate. So,
Exactly.
All right, so let's pry that space open, hold it, and then let's go there next time we talk.
Sounds great. Thank you.
All right, my friend. It's really good to see you, Leah.
You too.